We're now joined by Cary who's the CEO of the Union for International Cancer Control in Geneva in Switzerland. Thanks very much indeed for joining us. Welcome to the program.
It's a pleasure being with you. Thank you for the invitation.
All right, I know that your organization, one of the issues that's big on your agenda is equity, and this falls in line with this theme for 2022 through to 2024. Tell us about the challenges of equity and what they actually mean for lives and people on the ground.
Well, you're right. The three-year theme is called Closing the Care Gap, and that actually covers the full spectrum of cancer control issues. That's the prevention, the early detection, the treatment, and the care of cancer patients. And what we see around the world, what we see in regions, what we see in countries, what we see in cities actually, is a disparity between the number of people who survive a cancer, depending on where they live, depending on their type of community, the funding they have available, the knowledge they have available, their educational status. All of this leads to a point where we see big differences in survival rates from one place to another. And so closing the care gap is about raising the profile of these differences and then hopefully motivating governments and others around the world to try and address them. So that, for example, a child with a childhood cancer in Africa has the same survival rate of a child who has cancer in America, which is 80% compared to 20%. And these are things which appear around the world, which we believe we need to address. And World Cancer Day is a great opportunity to raise the profile of those challenges.
You mentioned governments. Are we saying that governments are under-resourced, or is it perhaps they also not doing enough to deal with specific issues like closing the care gap?
We have seen over the last probably 15 years or so, the number of governments that have taken cancer seriously increased, and we measure that by the number of national cancer control plans which have been introduced and the amount of funding that's been made available in cancer control, whether that be on education, on the risk factors, the availability of screening services for the more common cancers, or the availability of treatment services, for example, radiotherapy, surgery, or medicines. So we've seen progress over the last 10, 15 years. Now, what we do know is when a government actually embraces a robust national cancer control plan and invests in cancer registries, the data collection process, so they understand the burden of their cancer, and they reach out to the community involving civil society, then we have the potential to address cancer in that country. And there's certain evidence suggested that that would actually happen. So I think we're seeing progress, but we have to also continue to press governments around the world to ensure that, one, health is part of their priorities, and universal health coverage is part of that. And within that, a national cancer control plan exists, which means that the community can take comfort that there's investment to improve treatment and care around their country.
One of the best things, of course, is always to prevent. And we hear more and more about a lot of cancers that are preventable. And on your website was an interesting article that I saw. Commercial interests are driving millions of cancer deaths. Talk us through that.
Well, yes. I mean, cancer has been linked very closely with a number of very clear risk factors, and one of them being the use of tobacco. So smoking is a risk factor for cancer. In fact, smoking kills about 8 million people around the year every year. About 4 million of those are people who then develop cancer, lung cancer, etc. So this is a commercial determinant which causes cancer, and it can be controlled. We have seen countries around the world, for example, Australia, that have imposed a lot of strict policies on the availability, the packaging, the cost, and the marketing capability of the tobacco industry to market their product to, for example, the younger generation. Now, the more that we focus on those risk factors, like physical inactivity, obesity, the availability of food, the appropriate labeling of food, which is of poor quality and can also contribute to cancer as well, the better we can reduce the number of cancers in the future. So that's where governments do play a role. The other thing, of course, is that a lot of cancers are linked to viruses. So cervical cancer is linked to human papillomavirus. So in countries where we see vaccinations for young girls at an early age, it means that their chances of developing cervical cancer in the future is actually reduced dramatically. And the world has agreed through the World Health Assembly that we should seek to eliminate cervical cancer in the future. If we do HPV vaccinations and we do early detection of precancerous lesions and we get treatment in place, then we can actually eliminate cervical cancer in this century. So there's lots of optimism about what can be done, but the risk factors are critical. The less cancer we have to deal with, the easier it is to deal with.
On a day like today, yes, close the care gap is the theme for the 3 years, but what other message do you want to get out today to help educate the public around cancer?
Well, what's been fascinating watching the world do World Cancer Day, and it's been on Twitter everywhere, and organizations, companies, individuals have used it to spread messages which are very important to them. It's a day, yes, when we have a theme, which is important, and that brings us together as the cancer community. But it's also important that organizations like the Pink Drive, for example, use the day to get messages that they think are important to the community in which they operate, which are very relevant to that community. So whether it's a prostate cancer foundation, a breast cancer foundation, a bowel cancer organization, a patient group which is committed to lung cancer, we are able to get messages out into the community on social media where people like you interview people like me so we can reach out to others around the world to get the key messages across that cancer can be prevented, it can be detected early, and if it is detected early, it can be treated successfully.
Yeah, I mean, when you hear the word cancer, the big C word, fear is the biggest response. We hardly hear the message that you're talking about now, is that a lot of it can be managed and dealt with. And then I suppose we need to get into the habit of self-examination, going for checkups, and making sure this thing gets detected early.
You're so right. And all the data shows that the earlier you detect any cancer, the chances of you surviving at 5 years increases enormously. Take breast cancer, which I think is the most prevalent cancer in many parts of the world and globally, for women certainly. If you detect it in stage 1, the chances of survival are 90% plus. In stage 2, 80% plus. Stage 3, more complicated. It's moved away from the breast. As we heard in your item that you showed earlier from that lovely lady, it's more difficult to treat, maybe 50 to 60% success rate over a 5-year period of survival. But when it gets to stage 4, not only is it a very complicated treatment, it's also generally more expensive. And the likelihood of survival is down to 20-25%. And this is true of all cancers. So education and people's understanding about the staging of cancer and their willingness to check themselves, go into their doctor or the primary healthcare system and to ask to be checked. And as soon as assuming that is available, then if it's detected in stage 1 and 2, then the chances of survival go up enormously. So I encourage everyone around the world that whenever you have a change in your body, something which concerns you, it is absolutely the right thing to do to go and ask to have it checked, to go to the Pink Drive, to go to a local cancer organization, to go to your doctor. Because if it's caught early, your chances of survival are much, much higher.
You've been watching trends over time and watching the global picture. Are there typical or increasing types of cancers that we should be paying attention to, particularly in our region here in Africa, that you're seeing becoming more and more prevalent?
Well, breast cancer and cervical cancer are prevalent right across Africa. And both of them can be treated successfully if the core infrastructure is in place, the radiotherapy, the human resources that know how to use those machines, the oncologists are in place, and the medicines are there. So the science, the for treatment is all there to go. And so those common cancers we can deal with if we get the medicines into the countries and we have the treatment and we have the qualified staff to do it. And that's probably the biggest challenge we face. The one that worries me in the longer term is obviously those that are linked to tobacco control. And if you see countries where there's an increasing amount of use of smoking, cigarettes, then unfortunately that has a consequence down the road. It may not be immediate, but down the road you're going to get lung cancers, head and neck cancers, throat cancers, etc., etc. So I think generally we're in a good position for the next decade. If we embrace the technology and the knowledge we have today and we invest appropriately with the international support that's required, I think most countries can put in place the basic infrastructure to deal with those most common cancers. We're still some way from the more complicated ones that can't be detected quickly, like pancreatic and liver cancer, but they're low numbers in low and middle-income countries. The more common cancers, we know how to deal with those.
All right, and perhaps a final word. There's something I keep seeing a lot more of now because it seems to be classier to vape, and we see young people sharing Hubblies and things like that. Give us a word on these two things in particular, because there seems to be some misconception that they're safer.
It's really heartbreaking for me to see the tobacco industry market nicotine products to young people so that they become addicted to nicotine. And over time, I'm sure that those companies will try to get them onto traditional cigarettes. And then, of course, we know traditional cigarettes are linked directly to your chances of developing cancer in your lifetime. Vaping and other new technologies are new. We don't have the data yet to show what the link is to a cancer. It'll be in 10, 20 years' time. But why should we take the risk? Why should we take the risk with a product from an industry who denied any connection between cigarettes and cancer for 40, 50 years? Why should we take a risk in allowing younger people to become nicotine addicted? That doesn't make sense. It's although we don't have direct connection yet with a link to cancer, there's already sufficient evidence to say that these are unhealthy. And as a cancer organization, a health organization, we therefore do not in any way support the availability of any alternative mechanism to impart nicotine addiction on any community. So I think it is very worrying to see the trends that are occurring at the moment, particularly in the younger generation.
Cary, we're going to have to leave it there. Thank you so much indeed for joining us, and we wish you well with the good work that you keep on doing. Thank you so much.
Thank you very much for having me on.
Thank you. All right, that's Cary Adams, who's the CEO of the Union for International Cancer Control in Geneva in Switzerland, talking to us on World Cancer Day. Stay with us. You're watching The Globe.